Hi, I'm Michael Maranzano. I'm a class of 2013 Global Health Certificate with a major in biomedical engineering and a minor in cultural anthropology. The word to describe my global health experience here at Duke is applied. I like to think of what we did as kind of taking all the in-class material, the lectures and coursework and whatnot, and trying to figure out how it applies in the real world. So a lot of the global health classes have a really strong project-based component, like the capstone class. Obviously, the entire class is a project, so we've taken what we've done for the entire 4 years here and tried to figure out how we can make a difference in the community. So our group specifically chose an actual project where we interviewed Native Americans in a community about 2 hours south of Duke and tried to figure out how we can prevent prescription drug abuse among the children there. So like we said, we took something that we've done in all the classes, kind of put it all together and made a real difference in the community. So that hands-on aspect is, I think, a huge major reason why the Duke Global Health Certificate is really fantastic. Actually seeing on the ground what you kind of read about in textbooks is a completely different thing. This past summer, I did a fieldwork project in Tanzania with Dr. Malkin out of the School of Engineering. That was my engineering distinction project. And so the project is this like ketchup package that's for antiretroviral drugs. I did a cross-sectional study to figure out what percentage of HIV positive women give birth at home. So it was related to the project, but it was completely from a different vein. And, building upon what I learned in class, I was able to kind of shift the project in that direction and still be productive over that summer. It took something that we talked about in class. We talked about prevention of mother-to-child transmission of HIV, and it kind of, from an engineering standpoint, the material aspects of the project kind of addressed that problem through the engineering side of things versus like a public policy or something side of things, where we make a technological solution and apply that. So it was really great that I was able to bridge everything together with that project. Dr. Malkin, he has a design class that's designed for the developing world. So that class, it's another project-long class, just like the Global Health Capstone class, where at the beginning of the semester you identify a problem, and over the course of the semester you work on a solution. So for that class, I made a fetal ECG monitor to kind of monitor the heartbeat of the child while it's still in its mother's womb for a developing world setting. I think the faculty are fantastic because they're not just global health people. They do things outside of global health as well. So like Dr. Malkin has a huge background in electrocardiology, and so that's why we did that fetal ECG project, and he was able to mentor us from the perspective of someone who's worked in the developing world, but he also had a huge background in recording heart signals, so it was great that we had kind of the direction from both of the titles that he has. I think engineers have always been really involved in global health, but it just hasn't been formalized before, and so now I kind of have this aspect that I have a greater understanding of the problem from all the classes I've taken the Global Health Certificate, and I have the kind of technology, that side of from the engineering, and I can put that together and kind of develop new technologies that could potentially make a difference in global health.